Hello everyone. We are now experiencing the second wave of the COVID-19 pandemic. As we all know, the most common symptoms we see are fever, cough, cold, and shortness of breath. Shortness of breath is actually experienced because the virus attacks our lungs. In this video, I will share with you information about how the virus affects our lungs and also about simple breathing exercises that patients can do to improve their lung capacity.
Subscribe now and press the bell icon. Never miss an update.
The main function of our lungs is respiration. Our lungs is made up of small air-filled sacs called alveoli. It is at this alveolar level that gas exchange takes place and oxygen is then supplied to our tissues and different parts of our body. When the coronavirus attacks our lungs, the alveoli are infected and gas exchange is disturbed. That is why the patient feels breathless and experiences shortness of breath. Before we start the exercises, a few tips. These exercises have to be performed slowly, sitting in a comfortable position and wearing comfortable clothes. These exercises are for patients who are having mild symptoms of coronavirus and also for those who have recovered from the coronavirus infection. The first exercise is a apical breathing exercise. In this exercise, we concentrate upon breathing in the upper part of the lungs. I will first describe how we do it. We need to inhale from the nose, hold up to a count of 2 and then exhale from the mouth. When we exhale, we have to keep our lips in a pursed lip position. Also remember, the exhalation has to be longer than the inhalation. I will give you a small demo. We need to keep the hands just under the collarbone. Take a deep breath through the nose, hold and then exhale. This exercise can be done 3 to 5 times. The second exercise is called thoracic breathing exercise. In this exercise, we will concentrate on filling air in the lower part of our lungs. In this exercise too, you have to take a deep breath through the nose, hold up to a count of 2 and then exhale pursed lip through the mouth. Let me show you how. We need to keep our hands on the lower part of our chest when we take a deep breath. As you take a deep breath, you will realize that the lower part will expand outwards. This shows that you are doing the exercise in a correct way. Take a deep breath in. This exercise also can be repeated 3 to 5 times. The third exercise is called diaphragmatic breathing exercise. This exercise mainly concentrates on the diaphragm muscle, which is one of the most important muscles of respiration. To do this exercise, we need to keep both our hands on our stomach, take a deep breath through the nose and exhale pursed lip through the mouth. When we take a deep breath in, air will fill into our tummy. That is what we need to feel. So we take a deep breath through the nose, feel our tummy fill with air and then breathe out through the mouth. This exercise can be performed in sitting position and also in crook line. This exercise can be performed 5 to 10 times. All these exercises help to improve our lung capacity and endurance. Make sure to take a deep breath in and hold the breath up to a count of 2, as it is very important in improving alveolar function. In addition to these exercises, I would also like to tell you to continue with mild or moderate exercises like walking within the house. A few more suggestions: keep yourself well hydrated, have a good diet of fresh fruits and vegetables to maintain a good immune system, avoid smoking, and avoid excessive use of air fresheners and such other things. As a healthcare professional, I cannot be at home, but if you can, please be home and help save lives. If you really need to get out, make sure you're wearing a mask, maintaining social distancing, and wash your hands frequently. Take care and stay safe.